Welcome back to the Unique Conversations with Chris podcast. I'm your host, Chris. I am here to share a recent conversation that I had with Dr. Stephanie Cudjoe. It's my belief that physical health and mental health go together. And if you follow the podcast since the beginning, you know I talk very candidly about mental health and my own journey with mental health, as well as share stories of others and their mental health and their journeys in life. And so I jumped at the opportunity to have a conversation with Dr. Stephanie Cudjoe to get her insight as to how we can manage our physical health better so that way we can have an overall better life, mental, physical, emotional, spiritual, everything. And so I had a moment to talk with her, and we had a very good conversation. And so without dragging this along, I am excited to share her with you. Dr. Stephanie Cudjoe is a board-certified family physician and the founder of BlueMed, a direct care practice in McKinney. Dr. Cudjoe graduated magna cum laude from Texas Lutheran University in Seguin, Texas, with a Bachelor of Science in Molecular Biology and a Bachelor of Arts in Chemistry. After earning her doctorate in medicine at UT Southwestern Medical School at Dallas, she completed the Baylor Family Medicine residency in Garland, Texas, serving as chief resident in her third year. Dr. Cudjoe has been practicing outpatient family medicine in North Texas since 2008. She often shares with her patients, the body has an innate ability to heal. All we have to do is provide the right environment. So welcome to the show. How are you today?
I am great, thank you. How are you?
Good. I would like to start off with some icebreaker questions, just so that everyone can get to know you. I know you, but I want to share you with everyone else. This might be a given, but if you could have any job in the world, regardless of the qualifications or experience, what would it be and why?
Any job in the whole world.
Mm-hmm.
It would it would probably be, and I had like full capabilities to do this job well.
Yes.
I would probably be some type of dancer.
Really?
Yeah. Or like a dance instructor or something, like a
So do
Debbie
you not
Allen.
dance now? Or is it just something that...
I have some limitations that keep me from dancing at the moment, but and, and it's been a while since I have danced like I think I can dance in my head.
Right.
I have
I
some
have a...
qualifying statements before I answer that. Or I would, I would probably be doing something. I think I would be doing something showy.
Right, right.
Yeah, I think it'd be fun. It'd be a lot
Yeah,
of fun.
yeah. If you have the same limitations of not having rhythm, that would be my thing. I like to dance, but am I good at it? No.
I love it. I love it. There are moves that in my head look a whole lot better than when I currently try to do them. So, that's still in the dream realm right now.
Right. But it's all about having fun. So,
Absolutely.
what's the best book, movie, or TV show that you've watched recently, and what did you enjoy about it?
I just finished Queen Charlotte
Okay.
and I loved it. I didn't think I was going to like it,
Mhm.
but it gave a very interesting perspective on unconditional love and on fighting and
Mhm.
for, not just for your own love, but for your country and what that looks like and what sacrifice looks like.
Mhm.
And so I just finished it and I was just
Okay.
like, what? They can't stop it now, right? They did such an excellent job. And then of course the backdrop and the wardrobes, the costumes, I mean all of the things, the hair,
Mhm.
all the things. It was a wonderful story that had lots of lessons, but also lots of pageantry, and it was just beautifully done.
Okay, and I'm gonna have to check that one out. I haven't watched that one, but then again, I don't have a lot of time to just watch TV. And when I do have my downtime, I'm usually trying to do other things to keep busy. But that sounds like something I might be into.
So when you get a chance, and it's not long, it's not a long series, but it
Okay,
definitely
that's another thing too. Is like you got to keep the attention span because I know
right.
for me, when I'm easily distractible, so it has to be good.
Do it. It'll do it.
Okay. Now, what's your favorite way to unwind after a long day, and why does that work for you?
After a long day, I like to listen to music.
Hmm.
That's very common. I mean, I kind of have a soundtrack going in my head at all times, honestly.
Uh,
Um, I wake up and it's music. In the shower, it's music. At the
okay.
office, there's music. You know
Yeah.
this.
Yes.
Um, on the way home, there's music, and at home, there's usually some music. But that's also the time that I get to reconnect with the kids. It's usually not till later at night that I really get to unwind because it's more
Mhm.
like evening shift
Mhm. Yeah.
versus, and I'm done.
Yeah.
Um, so I love to listen to music. If there's a show or something that we can watch all together that the girls want to watch, then we'll do that. After they've, of course, finished their studies, done their homework, and all the things.
Mhm.
Um, but yeah, I like to do that. I have a couple books that I am reading that I've been tasked to read, and so I might pull those out and take care of those and kind of do some because they're good for self-reflection, trying to
Mhm.
figure out, who I am now in this stage in life and then yeah, then I pray and it's time. It's about time. That 9 o'clock time is about to go off and it's like, okay, let's
It's,
go, kids.
yeah.
Bath to bed. Here we go.
Right. Do you mind sharing me what you're reading right now?
One book is called I Hurt, and
Okay.
another book is called Who Am I?
Okay.
Yeah,
Okay. I'm
they're
always looking for good reads, especially when you said it's about self-reflection and become more self-aware. That's something, of course, that I strive to do. And so I'm always looking for recommendations. I'll have to keep that in mind the next time I'm out looking for the
it's
next read.
yeah, they are very fresh um, perspectives
Hmm.
on figuring out why you do what you do, when you do what you do, and what could be driving those things. And so it's been very refreshing, a refreshing way to look at those things without condemnation. Really important.
Okay. So, like I said, I introduced you outside of this actual session, but I'd like for you to, in your own words, introduce yourself, tell them about your background and what you specialize in as a doctor.
Sure. So my name is Stephanie Cudjoe. I am a family physician in McKinney, Texas. I am a wife and mother of now three. I'm originally from Houston, Texas. Did my undergrad at a small university called Texas, Lutheran University in Seguin, Texas. Go Bulldogs. And then moved to the DFW area for medical school at UT Southwestern. Then you might be able to hear my little one in the background. I
All right.
apologize. But he is having a whole day today.
Yeah,
Um,
that's life as a
yes,
mom.
went to school, UT Southwestern Medical School, finished 3-year residency in family medicine, and have been in private practice for the last 15 years, the
Hmm.
last 6 of which I've been in my own personal private practice called Blue Med. And
Hmm.
it's been wonderful. It's been a way to fulfill a calling to take care of my patients the way that I think they want to be treated, they want to
Hmm.
be cared for, and also that is a bit lacking in the traditional medical setting. So it's been a huge learning curve, but it's been extremely rewarding, and I'm glad to be doing things like
I love that. So, Blue Med, I want you to explain that a little bit more because someone that's not familiar, how is Blue Med different from the traditional going into a typical doctor? Because that's where I met you, was within a traditional practice.
Yes, you did. Yes, you did. So everyone knows the hustle and bustle of, I think, a primary care practice. They know about the 15-minute visit, which is usually shorter than 15 minutes
Mm-hmm.
as far as face to face time. And yet they have concerns, so they're not exactly sure what's going on with them and don't
Mm-hmm.
necessarily have the language to describe what's going on besides, I feel tired, I'm hurting, I don't feel well. And so docs were being tasked with performing miracles in 15 minutes. That's really tough. That's really frustrating for the patient. That's frustrating for the physician. And that's where I spent the first 8 years of practice trying to buck that just a little bit, getting in trouble just a little bit for doing so.
Mm-hmm.
But I always had great Press-Ganey scores. The patients, I loved my patients. They loved me, but just the format of kind of the hamster wheel just was not the right setting for me. In Bloom Med, we decided to go about things a little differently and take away some of the challenges and hurdles that kept patients from even coming in, and
Mm-hmm.
then that kept them from coming back.
Right.
So, one of the first things that we did was we removed the insurance model because my
Okay.
main focus was I wanted to have as much time as I needed to spend with the patient.
Mm-hmm.
And insurance was a huge factor in how much time was spent because reimbursement is not quite the same. And in order to keep lights on, you have to see more patients, especially in a
Mm-hmm.
very top heavy organization. It was a very large organization. We took that out. We made it cash pay and we made the rates monthly. So what we did was we created a DPC practice, direct primary care practice, where you had a monthly subscription. And for that monthly fee, you were able to come in as many times as you wanted. So I had many patients that we were seeing on a weekly basis to get on top of things, to really understand what was going on with them, and to establish a
Right.
relationship with them. Um, we wanted to make sure our patients trusted us. We wanted to make sure that I understood who our
Right.
patients were so that when they called and they used their code words, we could understand what they were talking about. We kept our overhead low and we really just focused on giving good care. That was about 6 years ago when we started. This last year, God has challenged me to reintroduce insurance, but to keep that same care that we give our patients. And so we have started to inch towards that, but that will
Right.
not be our
Okay.
primary focus. It's just so that we can expose those that need the care to us,
Mm-hmm.
and then they can decide how they want to move forward. But essentially, my eyes were open that there are a lot of patients that could use our
Mm-hmm.
services, but are not quite. They weren't quite ready to
Okay.
try a new model like DPC. So
Right.
this is how we're going to bring them in. We're going to show them what great care looks like. And then they just won't help themselves. They're going to say they want more of it. And so they will sign up for membership as well. So now we are what's called a hybrid DPC practice.
What inspired you to become a medical doctor?
Okay, so initially when I was in college, I was going to be a science teacher. And for some reason, I was enrolled in the pre-med program at Texas Lutheran University. I did not sign up for pre-med, but my advisor, who was specifically a pre-med advisor, said, "Don't worry about it. You're going to take the same classes anyway. You'll be fine." And so I said, "Okay." So I did it. So I took those same classes, enjoyed myself, needed a summer job, and did some research for 2 summers at UT San Antonio, and was preparing to go down research track. And then the summer before my junior year or before my senior year. I did that for 2 summers. So summer after freshman, summer after sophomore. So summer after junior year or during junior year, my pre-med advisor said, "You probably need some more change, huh? You're broke." And I'm like, "Yeah, I'm broke." She said, "Well, they are taking applications at the Guadalupe Valley Hospital ER for emergency room technician. So you can do that on the side while I was doing like some teaching assistant work and stuff during the school year. Well, the first day that I was there, I was like, oh my gosh, this is amazing. The ER was exciting. We were pumping people's stomachs. Folks were coming in accidents. I mean, they were doing everything. They were doing STD testing. They were doing heart attack, stroke workups, you name it, they were doing it. And I was there for it all. And all I was doing was pushing people around and cleaning people up. But I knew that I wanted to be in medicine from that job.
So it sounds like it was just a one of those things where you were mysteriously enrolled in pre med and found your calling. That's interesting.
That's what inspired me. I had no other thoughts of becoming a doctor prior to that. And it was nothing else besides I'm going to be a doctor after that. So that was my inspiration.
Most people, you would think, oh, I've always wanted to be a doctor ever since I was a kid, or I dreamed of being a doctor. And so it's funny that I didn't even know that story, but yeah, that you just so happen to fall into this grand scheme or this plan to become a doctor, which in my opinion is was your true calling, because you know my story that I was on the search and further on the hunt to find someone that not that I did not trust, but that I could that I felt like actually cared. And so I feel like that it's a very unique situation, and I'm happy that you follow that path, because you have certainly, if you're not anyone but myself, you've helped a lot of people take care of their health and get better. So I'm so happy that you follow that path.
Thank you. I just, I'm still teaching. I'm always teaching.
And I definitely noticed, and I think that's probably why it resonates with me, because I'm a person I love to learn, and so I feel like you're not just saying, "Here, take this pill and come back in a month and let me know how it works." You're explaining to me, and not that I have to know all of the background details, but it helps me to understand the bigger picture when someone takes the time to listen and hear my entire story. And similar to what you were saying before, when you go to a doctor, you have about 10 to 15, maybe 10 minutes with them, and they're just kind of, the most of the time they're just typing away and asking a couple questions, and then all of a sudden, okay, here's your prescription, come back to see me in 3 weeks, without any real patient education other than here's a printout about whatever I'm just diagnosed you with. Or in my case, there's been times where I was diagnosed with something and I wasn't aware of it until I just so happened to look at the notes of my appointment, and I was like, oh, I didn't know that this is what they were saying that this was. That's interesting. And so
Boy. Mm.
so that, I think that really makes you stand out and stand apart from most of the other models. And so as much as I can, I recommend your practice to as many people as you know. And not even just me saying, hey, you should go there, but just me and sharing my story about how, and seeing how I've transitioned from where I was this point last year till now. People are like, well, what are you doing? Oh, well, I found this doctor. And people that know me, it's not that I am rebellious or don't want to listen, but until I feel that I can trust you to follow your advice, I'm going to do things my way. And maybe it's stubborn, but they were impressed.
I think it's human nature, and I think I try to respect the fact that my patients are functioning adults. And if I cannot provide a compelling reason to make the recommendations that I'm making and meet our patients where they are, then why would they change? Right? I would not, I would be concerned if someone was willing to take a pill and had no idea what it was. That's scary to me, right?
You're right. I'm not one of those people.
Yeah, neither am I, right? I want to know why I'm taking it. I want to know what I'm getting ready to feel like. Like that's me. So I try to extend that same respect to every single person that took the time to make an appointment, fill out all the paperwork, deal with, the traffic to get here. I want to do right by them, right?
Yeah. And speaking of that, it makes me think of a question. When you have a patient like myself, that can be a challenge. How do you approach the patients or their families with, like, difficult conversations about their health and recommendations that you may have. Someone that may not be receptive to saying, hey, Crystal, you need to take your blood pressure medicine every day, not just whenever you remember when you feel like it. How do you how do you find that line?
Well, I think number one, I I have to remember who my patient is. What are they dealing with? Is the reason that I'm making a recommendation is because they're distracted? Is it because they're stressed? Is it because they're low sleep? Right? Is there a way that we can get to my end goal by addressing their needs? Right? If their needs are met, then they may be a little bit more adherent to a recommendation and a treatment regimen. So I try to meet them where they are, but in order to do that, I have to know where they are. So sometimes the true recommendation that I give is not given on the first visit. Sometimes it's given on that third or fourth visit. There's even been times where the patient was so guarded that I didn't feel comfortable giving them that final recommendation. For example, that they have to stop drinking, they have to quit smoking in order to improve their health until I saw them enough times that I built some equity, some trust equity, right? And then once I felt like, okay, we have some trust equity, their guard has been, brought down a little bit, they're more open to receive, then I'll say, the thing that, the elephant in the room is that now now you know, we got to quit smoking, or, if we were to take our pill every day, we might see a more consistent result. Because harping on someone, getting angry very rarely is successful. I have on occasion gone there with the patient because my concern had gotten so high with their lack of care, self-care, that it was making me nervous. And so we had to have a little, come to Jesus moment.
Have conversation. Right.
Conversation, and that conversation really was more of, if my recommendations are not going to be taken seriously, then maybe I'm not the right person for you, and maybe I need to release you to find the right person. Right? It came out that way, versus, if you don't do this, this is going to happen. Nobody's going to. I mean, we're grown, right?
I've been on that receiving end of tough conversations, and I've shared before on this podcast that there was a time when my mental health was such in a poor place that the therapist that I was seeing at the time, she recommended a treatment plan a year prior to me going back and seeing her, following up, and she was like, if you don't adhere to this treatment plan, the same thing you're telling me now, you're going, I'm going to have to release you to find someone else. And that was the first time I've ever heard of or even been threatened to be broken breaking up with me as a patient. But I recognize that you're not just a doctor, that you are a person too. And so if you're seeing professionally, like, this person is not, we don't have the relationship, we don't have the rapport to where I'm either helping her and I'm doing her disservice and I'm not getting fulfilled from doing this, then it may be best. And so, just like I tell people with therapists or any other relationship with doctors or whatever, dentist, you have to find that person that you feel comfortable with or you respect, and you have that good relationship and rapport in order to get the best possible outcome. So I wasn't aware until I was on the receiving end that that could happen, but it can.
Absolutely. And a lot of times patients may think a dismissal a is a bad thing, right? But really, the goal, in the rare instances that I have dismissed a patient, it was because it became evident that we did not have the relationship that I thought that cultivated health. And that's our tagline for Bloom Med, is we cultivate health through the power of relationship. If we don't have a relationship building, how is your health going to improve? And the whole point of why we do what we do is to improve your health. That is the goal. And so if we feel like it is going in the opposite direction, or it is not, is this relationship is not a safe relationship, then we do have the liberty of dismissing and saying, you know what, we're going to allow you to find the person that you need to get you healthy, because that goal never changes. It just means that sometimes it's not going to be with us, and I have to be okay with that.
And that's so important. It also makes me think about something too, and I spoke about this in another one, but it was related to more or less mental health, but having cultural competence with patients and recognizing that that's an important factor in finding someone that can treat you or give you the best possible care and the importance of it. And I'd love to get your perspective on how you approach cultural competence and how do you make sure that you're giving sensitive care, because recognizing that sometimes some of the recommendations some people may see may be something that may go against their culture or their lifestyle. So I'd love to hear your thoughts on that.
Well, I think that it takes time. Number one, it takes time to really exhibit cultural competence. You don't necessarily have to know everything about every culture, but you do have to recognize that there are different cultures that affect diet, that affect mindset, that affects the family unit, that has expectations just on your role, right? So I have some cultures where the husband may do all of the talking and the wife says nothing, and I have to be okay with that, even though that's different from my culture. There are cultures that don't necessarily eat red meat, and so I have to consider that, and I ask the question, what is your diet? What does your diet consist of? Because I know that making assumptions will always mess you up. It'll always come back and bite you. And that's with people that I think I we share the same culture, but I don't know that 100%, right? And so someone might be vegan and I'm checking labs and I don't understand why I see abnormalities in labs. But if I ask them up front, tell me about your diet, right? And tell me what, is there anything that you do that you don't include in your diet that you consistently avoid? Then that lets me know that there may be an impact because of that in their diet, right? Or if they or have a great example, had a patient who was very slim, young guy, and we were doing a physical. We checked his cholesterol. He was fasting, but his cholesterol was through the roof. And in previous tests, his cholesterol was fine. I was freaking out. I was like, oh my gosh, we've got to get you to a cardiologist. You're about to have a heart attack or a stroke any minute. And so I brought him in and I asked him, I said, why is your cholesterol so different, this go round? And he said, oh, we've been celebrating one of their festivals. And during this, they have very rich food late at night for like the last 10 days, right before his blood draw. He says, I promise it'll be fine. Just give me a month. It's about to be over. It'll be fine. I promise. So I did. We rechecked it, and sure enough, it came back down to normal. I have never forgotten that. And now I consistently ask, are there any festivals that you will be observing that might influence your test results? Because that will save us an extra blood draw in the future. So, but that's just, to be open that there are differences that may impact your treatment care is very important to be receptive that things are not always the way you live, that people are living lives differently is okay.
And I think that's an excellent example of the importance of knowing being culturally competent, because someone else that may be in a traditional setting may have overlooked that and or not even took the time to deep dive and understand why this possibly could happen. They could just, like you said, send them over to a cardiologist and then they go through all these tests when it could be just a simple conversation of saying, oh yeah, I observed this particular holiday. We have this. And now, this is the reason why. Or, for another patient, I'm gonna use myself, you recognize that, okay, her blood pressure may be a little bit elevated because she's got all these stressors going on. Let's talk about a game plan on how to manage this, situation to see, to look at all the possible variables as to why this could be the picture of your health right now. And I think that was very unique. And I like that approach where it's more like a collaborative, innovative approach versus come in, I see this lab. I don't ask any questions. I just give you medication and then you go about your business.
Absolutely. Because that would be the faster answer, right? That would be the faster answer.
Right. Faster, easier.
Right. But we also believe that lifestyle trumps med. And so if we can figure out an underlying lifestyle hack of sorts to get you to the same goal and have the same protections, then wonderful, right? Medications are just tools, but they're not always the most appropriate when really we just need to adjust our lifestyle. And many times it's something simple. It's not having to remake your whole life, but it's just making these small little changes that over time really do compound.
Right. And that goes into my next question is how does nutrition and lifestyle play in the overall health and wellness?
It's huge. It's huge. It is, and it's huge for two reasons. Number one, healthy nutrition, because nutrition is just whatever you're feeding yourself, right? So, healthy nutrition is one that lines up with what your DNA instructions say is the best fuel, right? For operating. Unhealthy nutrition goes against that. And so, unhealthy nutrition tends to cause inflammation, it causes dysfunction of those cells. And over time, that causes dis-ease, right? The body is not at ease, it's actually manifesting symptoms of dis-ease. And so, nutrition is such a huge part. We talk about nutrition all the time. Doesn't have to be perfect because we live in a society where that is extremely challenging to have a perfect diet. However, we do know that the more consistent you are with giving your body the nutrition that it's looking for and it's been designed for, the better it will function and the less inflammation there will be, and the more in alignment your whole body will be. And that's not just physically, but that also affects mental health. That also affects, and I believe it also affects spiritual health because when you're dealing with disease, that also impacts your ability to receive spiritually and give spiritually as well.
I think that's powerful right there. With nutrition, not only impacts your physical, your mental, and your spiritual health. Some of the things and tips that I've shared, along mental health is taking care of your nutrition, moving your body, managing your stress, practicing self care, instilling boundaries, and all those things, which ultimately, if you're doing it for your mental health, is going to impact your physical health and the other way around. If you're doing it for physical health, it's going to improve your mental health. And then you brought in the spiritual health, that all these things, this vessel that we're all in, if we're cultivating an environment where it can thrive at its best. So I think that's important. As I was listening to you and I'm thinking about all the things that we're exposed to in social media and the media, you hear, all these headlines saying, oh, intermittent fasting will get you your results, or you got to do keto, or you have to do this diet, or you have to eliminate this, or dairy is bad, sugar is bad, salt, so you're hearing all these different things. And of course, I'm always the person that's a little bit skeptical because I have to check the source and make sure it's not some big company or big pharma or somebody that's pushing and implementing these thoughts and ideas to promote their newest product or promote their newest diet or whatever the case may be. But as a person that, because that's just who I am by nature, but for someone that may not have the same, I guess, desire to check into all these things, how would you advise someone to know what's good information and what's not good information as far as where to get health and nutrition other than going to their doctor?
That's a great question because honestly, even your doctor may not have the most um, researched answer. Let me just put it that way. So, not sure if a lot of folks know this, but unless you specifically took a class or a course after graduating medical school, at least if you're as old as I am and practicing medicine, there was not a specific nutrition course for us. It was eat right, exercise, right? And and that was pretty much it. That was pretty, I mean, eat less. And it was really not just eat right, eat less than what you're eating and move. And I did it and actually did research on this topic in residency. It's published in JAMA and excuse me, Journal of Family Practice, excuse me, and about the effects of nutrition and exercise on weight loss. I had to do a whole research project on this. This was not a course. This was a personal choice to do this research. And that's when I was able to say, okay, yeah, there is benefit of exercising 300 minutes a week, that there is additive benefits in 10-minute increments, but less than that, you're not doing much. You know, your body's not racking up the minutes there. And what a healthy diet actually looks like. I didn't know. When we were in medical school and we were trying to get fit, we were looking at the same magazine articles that everybody else was, you know. So I get that it is extremely frustrating and confusing as to what will benefit someone's body. But what I will say is that WebMD and Google are like big libraries. They have a lot of information, but there's also a lot of bias. It's very difficult to discern what is good information and what is opinion. And even with that, even in medical journals, you have to be very careful about what type of research was done, because some things are peer reviewed and other things are not. Some are meta analysis and some are not. And some are essentially are the equivalent of an opinion. And so if you're not careful, you might start quoting statistics that really are not based off of a sound research article. So all that being said, you know, getting with a licensed nutritionist and dietitian is very helpful. Getting with I mean, that's honestly the best place to get an individualized program. Intermittent fasting, keto, Mediterranean diet, pescatarian diet, those are all things that can individually lead to weight loss. It will lead to weight loss, yes. The question is for you and your lifestyle, what's going to be best? And so when we are tackling um, that question for our patients, the first thing that we do is we check your labs. We learn who you are, and then we come up with a program that takes that into consideration, along with all of the evidence that we know about these different options. Many times, it's so funny, people are already doing intermittent fasting, they don't even realize it. Because they don't eat anything until they eat dinner, and so they're already doing intermittent fasting. And so if they're trying to do intermittent fasting but change the hours, they wind up being a little disappointed with the lack of effect. But there are a lot of tools out there, and I encourage people to, if they don't know where to start, they can go to a place called nutritionfacts.org, and they have a wonderful, wonderful library of resources that talk about all of the benefits of nutrition on health. That is the place that I often go when there's a specific condition that I want to see if a nutritional intervention can help, when medications are not a good choice or a reasonable choice for a patient, or they are interested in the most natural approach. And so I go there because not only do they just give the recommendation, but they give you the articles with which support it. And so I appreciate the effort that they put into it. And so that's the place that honestly that I go to when I'm not sure of what to do for a patient to recommend. I go to nutritionfacts.org. So hopefully that answers a long answer for a long question, but hopefully that answers, gives you some place to go.
Sounds good. It sounds like you do incorporate some of the natural recommendations as well in your practice, which I find sometimes is not always the case. Can you shed a little bit of light about as to why you have that approach?
One of the things that I tell my patients is that there is no such thing as a medication deficiency. So the solution to a problem doesn't always end in a medication. I believe that in family medicine, at the very least, 95%, 98% of what we deal with is lifestyle disease. If we can utilize medications as tools to get our patients to where they need to go safely, or to bridge the time that it takes to build the habits that then can take over and keep patients healthy, then wonderful. If we don't have to do that, then why would we do it, right? If it's not providing an additional benefit, then let's do it in the most natural way possible. But that also means that it's going to take work. And if our patients are willing to do the work, is because it takes more than just not wanting to take medicine. You have to be willing to do the work. And if you're willing to do the work, then that work will pay off when it is implemented. So I want to give every patient the chance to not take a medication, because the more medications you add to a patient, the more risk there is for drug to drug interactions, the more side effects that we have to monitor. And maybe I'm just a little lazy, but I rather the patient take care of themselves than for them to be in my office all the time. We want to take that challenge away, right? Where they don't feel like they can't come to the doctor. They can come as often as they need to. But at the same time, the goal is that the patient learns how to take care of themselves. And to do that in the most natural way possible is also the way that will allow them to maintain their health for the longest time possible as well.
And that makes a lot of sense. It sounds like the ideal situation is for the patient as well as the provider to become partners and become expert on your own body. And so whether that's tweaking your lifestyle, whether it's implementing medications as a tool, not as a solution, and then also, more natural routes to get to the desired health or outcome. And I like that. As you're speaking about medication, one of the things, and I don't know if I've shared this with you, but one of the things that I found unique about you, even when you were within that practice of traditional medicine, is when I came to see you, I was seeing you about a number of things, but one of the things being my blood pressure. And I know that's something that is common with people of color. And one of the things that you mentioned to me, which I found to be unique, is I feel like another provider that I visited prescribed this particular medication that after you shared this with me and I did my own research was known to have adverse reactions in people of color. And so how do you manage or how would you recommend that someone manages when they're getting seeking medication or help or a solution, especially when it's something dire like blood pressure or cholesterol or something that's just got an immediate need to be treated that may take, a little bit longer for the lifestyle to influence the numbers. But how do we, as people of color, manage to make sure we're getting the best possible treatment?
I think that's a great question, because how do I say that? Not every physician is looking at the cultural best choice. While that medication that you are prescribed is very effective and can be tolerated by people of color, there is a high risk of angioedema associated with it, which is swelling in the mouth and around the throat. And even the tongue can get swollen. And, you know, not every medication is like that, but there are some medications, especially for blood pressure, that there have been research studies, very good research studies, that show these work better. These are better tolerated. This class of medication is better tolerated. This would be the first line for African Americans. I mean, that there has been a wealth of knowledge in that area. So, at least in the area of blood pressure, I would like to think that most physicians are aware of those things. It's whether or not they are taking the time to put that into their consideration. I think it doesn't hurt to ask questions of your physician to understand why they're choosing this medication over another. I think it's important for patients to understand that there is no one medication recommendation, that there are options. There are many, many times, especially in family medicine, we have options, and it doesn't always have to be the latest and greatest medication that's out that is the most appropriate for you. So to just ask their physician, do you feel like this is the best choice for me? And what are some other options that I have that could do the same thing? Why are we not, is there a reason why we're choosing this one over, say, something else? And you don't have to know what the something else is, but just know that there are options out there makes a difference. And that can bring enough of a pause that the doctor then says, okay, well, the reason why I'm choosing this is because of XYZ, not XYZ, ABC. And so if they're able to provide that, then that can give you a little bit more reassurance that there is a thought process behind it, and it's not just by habit, or it's the last three people he's seen with this condition, they've written this, or she's written this, and so they're just on autopilot. So I think taking the liberty, even though you have 10 minutes, to say, hey, if they're recommending a new medication to you, asking, is this the only option for me, or is there another medication option that I can look up or think about or consider that we could consider for treatment of this condition? I think is in no way, shape, or form disrespectful. It's you actually advocating for yourself. And I've had that same the effect that I didn't want you to have. I've seen it personally in my mother and my grandmother. And so it's very, very dear to me, and I pick up on it very quickly. I have very, very few people on that class of medications because of it.
And that makes sense. I mean, it's a personal experience with having a family member experience that reaction. And so that's why I feel like it's so important that we become very aware and educated and start to be more inquisitive about the approach and in a respectful manner as to and kind of be more of a partner and somebody to say so when it comes to overall health. As you're speaking, one of the questions that popped in mind was, I know that for a lot of us in the Black or African American community, I hear quite often that I already know the advice of what I'm going to get when I go to the doctor. Oh, they're going to tell me I need to lose weight, and this will improve my blood pressure, it'll improve my cholesterol, it'll improve, all these other factors that you check when your physical comes around. And some of the resistance and some of the things that I've seen in the media and the research is that there are some that have a controversial take on the BMI, and that's something that's being used, to measure how healthy you are in regards to weight. And some of the critics say that BMI was not created for someone that looks like us or someone of color or different nationalities and different cultures or demographics of people, that BMI may not be as accurate as a way to track and measure health. And I just get curious about your take on that.
Well, I'm so glad you asked. So yes, the BMI is based on a more narrow demographic of people. However, we do know that a BMI of 30, normal being 19 to 25, but a BMI of above 30 is considered clinically obese. Okay, it's a diagnosis. Okay, and it is a marker and it is a tool. No matter what culture you come from, a BMI of 30 confers an increased risk of heart disease, diabetes, stroke, hypertension, hyperlipidemia, high cholesterol, peripheral vascular disease, renal failure, all the things. Okay, it also increases risk of cancers. Okay, sleep apnea, all these lifestyle things that family medicine sees. There's a significantly increased risk at a BMI greater than 30, regardless of your heritage, your culture. Now, when we get into the 25 to 30 range, that which is considered overweight, depending on your background, your culture, there is a difference in when we begin to see that curve go up in the risk of those cardiovascular diseases. For African Americans, that curve tends to start a little bit later, okay, closer to say 27, 28. For those that are of Asian descent, it starts very abruptly, very close, not sometimes less than 25. Okay, they start to see increased risk at a much lower BMI than, say, African originated cultures. So it is important to keep that in mind. Again, being culturally sensitive and not being having inertia, say, for our Asian populations, because their BMI is 25, not checking for diabetes in those patients because their risk is actually much higher. They may be a normal weight and yet be pre-diabetic. I have a colleague that I know very well that is dealing with that, and they run marathons. So it is, it's not perfect. It is a tool. And so what we do, what we're supposed to be doing is compiling data points for our patients. What is not just their BMI, but what's their waist circumference? What is their body composition? What does that look like? How much muscle do they have? Because you could be of normal weight, right? But have a very high body fat percentage. That's called sarcopenic obesity. And they have all the same risks for cardiovascular disease as someone who has a BMI that's over 30. So BMI is just a tool. It's not enough to say, oh, we're going to throw it all out because it's not a perfect tool. Nothing is. Nothing is, right? Two people are 200 pounds. One is a bodybuilder and the other is not. Different of heart disease, right? So we need to keep in mind who the patient is and look at all the tools and see what story it's telling in order to make the recommendations. And so for those patients that are saying, oh, the BMI isn't built for us, well, it is. We can still use the tool. We need to just keep it in perspective. That's all. And not solely base recommendations off of one of those tools, but use a compilation of tools, use a toolbox to determine what the best treatment goals and methods would be.
It seems like a common theme is obesity. And I think that's just a topic where you hear people saying that they'll try all these different weight loss solutions, or you hear about the injections that people are doing now. If you could give like a blanket of advice, recognizing that you're not the medical provider for everyone watching this, but outside of what did you recommend for someone to do to manage their weight and get out of that obesity category?
We have to take a good look at ourselves. And as one who fights obesity herself, we have to figure out why we choose what we choose when we choose it. And better stress management many times leads to better sleep, which leads to making healthier choices. If we can get our mindset in a place that is healthier, many times we don't pull for the same types of foods. There is a whole concept about emotional eating and using food as a medicine, just like people use cigarettes, alcohol, other recreational substances, right, to help cope with the stressors of life. But it also could be habit. It also could be the way that we are raised. It could be our expectations around family gatherings and things of that nature that influence the types of foods that we choose. But the fact of the matter is that we are adults now, and our body is programmed to get used to and crave what we give it. And we have a lot more control over the choices that we have when it comes to nutrition than I think we give ourselves credit for. Yes, there are injections and there are pills and there are things that can help us see that we can lose weight when our nutrition changes. But the fact remains, regardless of the tool that we use, it's always going to come back down to healthy, consistent habits and having a reason to choose those healthy habits over our default unhealthy habits. Rarely is it that a underlying medical condition specifically causes obesity. Rarely is it that a medication specifically causes obesity, while we do have to keep that in mind. The majority of people that come to us are not on medications yet. They've been avoiding the doctor, right? And so we always want to tackle our nutrition and our healthy movement. Now, healthy movement is important to health, but it is actually not the best way to lose weight because you can out eat the treadmill. In fact, you can out drink your treadmill with smoothies and shakes and things of that nature. So the most effective way to get to a healthy weight is through healthy nutrition and with caloric reduction. Just because you're reducing your calories doesn't necessarily mean, though, that you have to be hungry. And so getting with a good nutritionist, a personal trainer, someone that has experience and the expertise to help guide you in creating a program that will keep you satisfied while losing weight is very important, so that you can see that it can be done. Once you see it can be done, then many times the onus then becomes, okay, well, am I willing to do what it takes to take care of my future self by making healthy choices now? And that's a really, really tough question to answer truthfully, because some days you don't care about your future self. And other days you are considering your future self. So there has to be something that draws you towards that future healthier self than the future unhealthy self, right? So I hope that answered the question, but there are tools out there, there's medications out there, there's even surgeries out there that can help you get to your goal. But what's going to keep you at a healthy place it will always be your lifestyle, your health, your habits, regardless.
I like that because it's true. Because you touched on so many points that things that I know from my own story is that it wasn't until I embraced a lifestyle and a mental shift that the numbers dropped, that the blood pressure became something that was manageable, that I started to feel better and have more energy. That so it doesn't matter. It did help to have the medication, but without the lifestyle, the medication was just there to essentially put a band-aid on something that was needing a lot more than just this medication that's used to assist as a tool. So I hope that resonates with people, and it encourages them to take action, especially in the mindset of we're coming up on the holidays, and sometimes those traditions and things that we like to enjoy and indulge in, maybe perhaps taking a different approach and maybe see if we can find a different way to prepare that same thing, so that way we're not indulging in things that's going to cause us to have issues weeks down the line, or maybe just enjoy it for that one time and not eat it for a whole week or two, or do it in moderation. That's something that I've learned with working with you is you can enjoy those things, but in moderation.
Absolutely.
Now, in your opinion, what are the major uh, diseases or things that you notice that are plaguing the America right now?
Number one, it's obesity. I mean, we really are in an epidemic. We are fighting against hidden sugar, salt, and fat in all of our foods, even in the foods that are considered diet foods. We are stressed in dealing with depression, in dealing with anxiety, and lack of sleep. We're scrolling on our phones, and we are inundated with all kind of messages that affect our mental health. So I think that that is a huge thing. The most common things that we deal with in our office, I think, is just, a great example of what we're seeing across the board in the US. It's obesity, it's his high blood pressure, it's diabetes, it's high cholesterol. I call those three the trifecta, and have saved templates for that. But then, like I said, it's also mood. It's depression. It's anxiety. And then sleep apnea. We're seeing a lot of that. But also, we see a lot of asthma. We see a lot of thyroid disease, and then we have some smattering of other autoimmune diseases that likely are, in my opinion, still related to how our nutrition is interacting with our genes. But that's my just personal opinion. Don't quote me on that. But I mean, it's the lifestyle diseases are the ones that are stemming from obesity and stress management, or lack of healthy stress management. If we can get those two things under better control, we'd be a lot healthier population. We'd be saving a lot more money, um, a lot more healthcare dollars, and we wouldn't be overrunning the hospitals. But these are some uphill battles that we are fighting. I don't think that it's impossible, but it's going to take more than our little clinic to reverse it, but we can at least help one patient at a time.
I love that answer. If you could give a single piece of advice on how someone could manage their stress, what would that be?
Ooh, one piece of advice? It would probably be to remember it is all a journey. It's all a journey. This is not the end of the journey. You're going through. Tomorrow will come. Uh, and if it doesn't, then what are we stressing about? So we're going through, and because we're going through, it's all a learning process. There are no mistakes, just learning experiences. It's all a journey. When we can do that, stress levels hopefully decrease if we truly begin to believe it. We can deal with a lot of really, really hard things, and hard things are part of the journey. That's what makes it interesting. If it was perfect, it would be boring. And I don't believe God likes a boring story. So he grows us through challenges. And that's how we learn who we are. That's how we learn about the people around us. That's how we learn about our God. And that's how we learn about what our purpose is in life, is through challenges. That's how we learn. So if we're not going through a challenge, we got to accept that this is the world we live in, and begin to prepare each day for the journey.
I like that. It is so much wisdom in that, because one of the things that I like to live by is this thing I'm stressing on. Will it matter 5 minutes or 5 days or 5 years from now? And if it doesn't, then there's no need for me to worry incessantly about it. And so sometimes I will check in. Yeah, I still fall into the category of where I will, get into a panic and I stress about things. But sometimes I'll stop and say, hey, is this not going to matter? Or is this going to impact my future, long term? Then it's not something that I need to stress about. And so I think if we took that approach, like you suggested, and a lot of the stress induced illnesses may, you know, be not as present if we just took a moment to reflect on what's important, what matters, and then just embrace life as a journey. And it's not going to be a smooth ride all the time, but we can just kind of learn to ride with the wave and embrace it and recognize that tomorrow's a different day. And as long as we have another day, then we're doing the best that we can. One of the other things that I wanted to do before we end here, because I feel like this is a lot of good information, is I'd like for you to spend a minute and just kind of share more about what's going on with you, what's to look forward in the future, Of course, at the end of this, I will have your information. So if there's anybody that would like to seek your help with their medical journey, then they could be able to reach you. But just in your own words, I know that you say you have a lot going, so I'm just curious as to what that looks like.
Bloom Med is growing leaps and bounds. We have a growing membership population that we're taking care of very well. We have our patients that now are able to utilize insurance for their services. Now, it's not, the VIP access, that our members get to enjoy, but it does allow them an opportunity to have a different experience with medicine and with a physician. We've just opened up a aesthetics room where we're able to now take care of patients not just on the inside but also on their outside. So there many times are concerns about how their body will look once they do get to that healthy weight. And so we've been able to address that now with our aesthetics room. We've got medical grade facials. We have Morpheus 8 to take care of skin laxity, cellulite, even excess fat that's been in trouble spots that have been really refractory to someone's efforts at getting to a healthy weight. We also have a weight loss program to help assist our patients and provide accountability. We utilize an in-body scanner that's a little bit higher level than, say, some of the ones that people will find at the gym, because it lets us know about body composition, if it's in balance, what that BMI is, but also how their body muscle, the muscle and their fat is distributed, and can give us some really great information with which to create a nutrition program. We have so many things available to our patients to get them to their healthiest selves, and we want to partner with them to reach those goals. So we're trying to make these things available. We just trying to get the word out. So I'm so glad and so wonderful, so thankful for this opportunity, Crystal, and hope to see someone coming soon.
Well, thank you. I mean, it's been my pleasure to have you on. As you know, I am no person to that's shy about recommending you and your staff. I can't say enough good things about you all. And so that's one of the reasons why I felt the need to ask you to come in, just sit and talk with me about some of the things that I brought up. I have certainly enjoyed our conversation today and look forward to this being a conversation to lead to many more conversations about our health. I recognize that I've consumed enough of your evening. I just want to say thank you for taking the time out of your busy schedule. I know you have so many things to do and so many hats that you wear. And I truly, truly appreciate your time. And I appreciate you. And I'll see you in my next appointment. Thank you.
All right, awesome. Thank you. Thank you so much again for having me, and I will see you soon. Bye.